Hello guys, hello, I am new to this channel and today is our first session on bone, skin and soft tissues pathology. We'll be starting with pathology first. Then I'll also be covering microbiology and pharmacology as well. So if you are new to this channel, please subscribe. So let's start. So first is osteomyelitis. First is osteomyelitis. So as we can see, osteo means bone, myel means marrow, and itis inflammation. So it is inflammation of the bone and the marrow by any virus, fungi, bacteria. So the most common causes. So first we will go to etiology. Most common cause is bacteria, Staph aureus, the most common in micro as well. So other organisms are they are almost same as causative agents of pyogenic meningitis. So Neisseria gonorrhoeae, Klebsiella, Pseudomonas, E. coli, Haemophilus influenza, Salmonella. For neonates, it is Haemophilus influenza and Group B Streptococcus pyogenes. Now it is divided into primary and secondary. Primary का मतलब है where the bone is a primary solitary focus. ठीक है. Whereas in secondary, it is the infection of the bone is developed from any systemic infection. Next is entry. How can it enter? First is through blood, hematogenous route, है ना, hematogenous spread. Second is direct implantation by penetrating wounds, by any fracture or any surgical procedure. And third is from any adjacent site, contiguous sites. Next is pathogenesis. Pathogenesis, it is very simple. First, okay, I have one more PDF here. So we'll open this. Yeah. So pathogenesis, we can remember by this flowchart. First, there is localization of the bacteria. There is a transient entry of bacteria through hematogenous route, through blood, let's say. So, yeah, localization of bacteria. This localization of bacteria will induce acute inflammatory reaction. So there will be recruitment of neutrophils, macrophages, and all. So it will migrate to the metastasis. These bacteria, they will migrate to the metaphysis of long bones. Why? Because the capillaries there, they form loops. Capillary form loops. So there is slow blood flow, which will allow the bacteria to. So due to slow blood flow, there will be induction of acute inflammatory reactions. There will be influx of neutrophils, macrophages. So because of that, there will be exudate formation. Continuous exudate formation will cause increased tissue pressure. This will suppress or compress the blood vessels, cause ischemia and necrosis, also known as segmental necrosis. Now this transmission of infection, the infection is transmitted to the periosteum through the Haversian canal, and this will lead to subperiosteal abscess formation. Now there will be, due to this abscess formation, there will be lifting of the periosteum. Now this will further impair the blood supply and will cause devitalization of bone, resulting in the formation of sequestrum or dead bone. Now this sequestrum is fragments of dead bones embedded in the pus cells. It is a fragment of dead bones which is embedded in pus. Now this will lead to rupture of the periosteum and formation of a draining sinus. Now what is sequestrum? As we have read, there is a decrease in the blood supply, lead to segmental necrosis. The fragments of the dead necrotic piece of bone which is embedded in the pus, this is known as sequestrum. Now there is lifting of the periosteum, form soft tissue abscess, may penetrate the skin, will form draining sinuses. So the hole formed in the bone during the formation of a draining sinus is known as cloaca. Now what is involucrum? After the first week, there is chronic inflammatory cells. They become more numerous. There will be cytokines like platelet-derived growth factor. They all are released to simulate the osteoclasts. Now there will be deposition of a bone in the periphery. Now the reactive new bone which is formed is known as involucrum. So we have sequestrum and involucrum. Sequestrum is the fragments or the dead necrotic piece of bone, whereas involucrum, it is the new bone formed or which covers the area. Next, morphology. Now we will talk about the gross and morphological features. Coming to the morphological features, it will depend on the stage, whether it is acute, subacute, chronic, and the location of the infection. Gross में the sequestrum क्या होता था? Dead fragments of necrotic tissues. It appears as fragment of bone with ragged brownish to black colored margins. As we can see here, this is a sequestrum. So we can see brownish to black. This is a sequestrum. Brownish to black with the colored margin. Brownish to black colored margin we can see here. Now this is, first there is micro abscesses which is formed here. Capillary loop is present. So there will be stasis of the blood. In the second image we can see there is expansion of the septic focus. So there is abscess formation which is your periosteal or subperiosteal abscess. Yes. Then we have the sequestrum which is formed. This is a periosteal elevation, that is lifting of the periosteum. Then this is the sequestrum. These are the dead bone fragments. Then forming sinuses, draining sinuses. There are pus. This is the reactive bone which is involucrum. This is the new bone which is being formed. Okay. Next we have gross appearance. Then we have sequestrum. This is the dead bone. This is the new bone which is being formed. X-ray showing sequestrum. So we can see this is the sequestrum. This is the involucrum. Next is microscopy. In the initial stages, only neutrophils are seen. So these are the acute inflammatory cells. As the disease becomes chronic, neutrophils are mixed with chronic inflammatory cells like lymphocytes, plasma cells. So initial stage में only the neutrophils are seen. Chronic stage में neutrophils, then lymphocytes, plasma cells, all are seen. Sequestrum does not show osteocytes and have empty lacunae. Sequestrum do not show osteocytes because they are dead. No, because they are necrotic tissues. तो उसमें osteocytes तो नहीं रहेगा. Next we have morphological variants of osteomyelitis. We have broody abscess. It is a distinctive form of subacute pyogenic osteomyelitis. There is sclerosing osteomyelitis of Gary. It is characterized by extensive new bone formation which obscures the underlying structure of the bone. Typically it develops in the jaw. So we can remember this. Sclerosing osteomyelitis of Gary. It typically develops in the jaw. GJ. Okay. Now we have complications. Complications of pyogenic osteomyelitis, septicemia. It will cause sepsis. From infection in the bone, organism may disseminate through the bloodstream, cause septicemia. From the bone, it will enter the blood, causing septicemia. Acute suppurative arthritis. Infection may spread through the articular surface into a joint, producing suppurative arthritis. May lead to destruction of the articular cartilage, permanent disability, common in infants. That can also cause pathological fractures. Squamous cell carcinoma. It may arise from the epithelialized sinus tract. Secondary amyloidosis. Chronic osteomyelitis. It may develop due to delay in diagnosis, extensive bone necrosis, ineffective therapy. So The most common complications: septicemia, acute suppurative arthritis, secondary amyloidosis, pathological fractures, chronic osteomyelitis. Then we have the clinical course. What do the patient present with? Malaise, fever, chills. There will be increase in the leukocytes, throbbing pain over the affected region, throbbing type of pain. Diagnosis will be done by radiography, lytic focus of bone destruction, gets surrounded by a zone of sclerosis. Blood cultures are positive for the bacteria, biopsy, bone culture. So here we can see there is three types of osteomyelitis. We have pyogenic, tuberculous and chronic non-specific osteomyelitis. Pyogenic means Staph aureus is the most common. Pyogenic osteomyelitis. In sickle cell, it is Salmonella. SS, sickle cell and Salmonella. Now these are the routes of spread. Hematogenous, direct contact, या फिर spread from a adjacent site or contiguous site. Sequestrum क्या होता है? It is fragment of dead या devitalized necrotic piece of bone embedded in the pus. Involucrum is a new bone formation around the sequestrum. Now Brody abscess, solitary interosseous abscess. Now complications are septicemia, acute suppurative arthritis, pathological fractures, amyloidosis, secondary amyloidosis and chronic osteomyelitis. Now coming to tuberculous osteomyelitis. Let me change the color. Tuberculous osteomyelitis. As we know, tuberculosis can be caused by mycobacterium. Yes, it is usually solitary, but in patients with acquired immunodeficiency, in patients with AIDS, it is multifocal. In normal patient में it is solitary, मतलब एक ही फोकस में होता है, बट एड्स में मल्टीफोकल होता है. It tends to be more destructive, resistant to control than pyogenic. It usually occurs in adolescents, young adults in developing country. Source of infection, pulmonary और extrapulmonary tuberculosis हो सकते हैं. Predisposing factors are the other comorbidities, diabetes, immune compromised states. And then route of infection. Route of infection में we have bloodborne infection, which is from a focus of active pulmonary disease or extrapulmonary disease. Direct extension from lung into a rib, tracheobronchial nodes into adjacent vertebrae. Now what is port spine? Port spine is important. The spine, the thoracic or the lumbar vertebra, commonly known as port disease or tuberculous spondylitis. It takes place in the thoracic and lumbar vertebra. Now port disease, also known as tuberculous spondylitis, it breaks through intervertebral discs to involve multiple vertebra, extends down into the soft tissues, forming abscesses, cold abscess, psoas abscess. So port spine, or also known as tuberculous spondylitis. The infection breaks through intervertebral disc. तो intervertebral disc से होता है वो. It breaks through the intervertebral disc to involve multiple vertebra. This is the key. Multiple vertebra extends down to soft tissue forming abscess. Cold abscess बनाएगा. Microscopy shows dead bone surrounded by tuberculous granuloma. TB का common feature होता है granuloma, है ना? Forms tubercle, hard tubercle, soft tubercle. So it will form tuberculous granuloma. It consists of central area of caseous necrosis having epithelioid cells, Langerhans giant cells. Epithelioid cells are the macrophages are converted into epithelioid cells. Then we have Langerhans type of giant cells. Then peripheral zone consists of lymphocytes and fibroblasts. The epithelioid cells have pale pink granular cytoplasm. Nucleus is oval. Okay, what is the clinical feature? There is low grade of fever with evening rise of temperature, the most common for TB related. Pain on motion, there is localized tenderness, there is weight loss. Low grade fever, evening rise of temperature, weight loss, suggest TB. Now we have complications of the spine. Complications of the spine, we have destruction of the vertebrae. So since it involves intervertebral discs, involves multiple vertebrae, so we have destruction of the vertebrae. It will cause scoliosis, kyphoscoliosis, psoas abscess. Infection from the spine, it may enter into the soft tissue anteriorly, and pus necrotic debris may drain along the spinal ligaments. We form cold abscess, that is an abscess lacking acute inflammation. Psoas abscess is the condition in which the infection from the lower lumbar vertebra dissects along the pelvis and appears as a draining sinus of the skin in the inguinal region. May be the first manifestation of tuberculous lymphadenitis. Psoas abscess क्या होता है? From the lower vertebra, lumbar vertebra, the infection will spread and along the pelvis and will appear as a draining sinus of skin, and it will appear in the inguinal region. ठीक है, तो रुको. psoas abscess में होता क्या है? From the lower lumbar vertebra, the infection will spread along the pelvis and will appear in the inguinal region as a draining sinus. Okay. Next we have tuberculous arthritis, sinus tract formation, amyloidosis, secondary amyloidosis. Next we have Paget's disease. Paget's disease, it is very important, of bone, or osteitis deformans. So what is Paget's disease? Let me change the color. Okay. So it is a unique skeletal disease or condition characterized by increased but disordered and structurally unsound bone. It is increased, structurally disordered, unsound bone. It is a skeletal disease. Paget disease is a skeletal disease. So let us write Paget disease. It is at Paget's disease. It is a unique skeletal disease which is characterized by increased, disordered, structurally abnormal bone. There is increase in bone, there is disordered bone, and structurally abnormal or unsound bone. So how is it happening? Pathogenesis, there are genetic factors and there are environmental factors. 50% are familial cases, 10% of sporadic cases show mutations in this gene. The gene is very important. SQSTM1 gene. So there is mutation in the SQSTM1 gene. These mutations increase the activity of NF-kappa B, which increases the osteoclast activity. So there will be increased bone का जो production होगा. So this, due to mutation in this SQSTM1 gene, there will be increased NF activity. Now this will increase osteoclast activity. ठीक है? These are interrelated. So how is Paget disease happening? It is due to mutation in the SQSTM1 gene. So it will cause increased NF-kappa B, which will increase the osteoclastic activity. Environmental factor, infection of the osteoclast precursor with viruses, alters vitamin D sensitivity. It will lead to increased bone resorption. Now morphology में क्या है? To show histological variations. Phase. It can be divided into 3 phases. You have initial osteolytic stage, mixed osteoblastic stage, and final burned out quiescent osteosclerotic stage. So we have osteolytic stage, osteoblastic stage, osteosclerotic stage. So first is your initial osteolytic stage. characterized by numerous large osteoclast resorption pits. Osteoclasts may have 100 or more nuclei. Findings are not clear. Okay. First is the initial osteolytic stage, in which there are numerous amounts of osteoclasts. Now, next is the osteoblastic stage. In this stage, there is both osteoblastic activity. Osteoblasts persist, but many of the bone surfaces are also lined by prominent osteoblasts. Progresses to predominance of osteoblastic activity. Next is final burned out quiescent osteosclerotic phase. The hallmark is a mosaic pattern. This is very important. Mosaic pattern, jigsaw pattern of lamellar bone during the sclerotic phase. Prominent cement lines which join haphazardly oriented units of lamellar bone. Jigsaw puzzle-like appearance. This is very important. Hallmark is the mosaic pattern of the lamellar bone. There is a prominent cement lines which produces a jigsaw appearance. So we don't have the photo here, but yeah, clinical course, it may involve one bone, monostotic or polyostotic. So this is majority polyostotic. In late adulthood, it is seen pain localized to the involved bone, enlargement of craniofacial skeleton, produce lenticulated lion face. Diagnosis, it is used by radiographic. Raised alkaline phosphatase levels, but normal serum calcium phosphatase levels. Complications are tumor or tumor-like conditions may develop in Paget disease. Secondary osteosarcoma may develop in less than 1%.